Good afternoon. I'm David Sweat, Deputy Director of Shelby County Health Department, and welcome to the City of Memphis and Shelby County Joint COVID-19 Task Force. We have now been at this for almost 1 year, and we thank you for joining us. I'm accompanied today by Chief Doug McGowen from the City of Memphis and Dr. Bruce Randolph, our local health officer at Shelby County Health Department. To give you an overview of where we stand with the numbers, we start out with Shelby County at 88,153 cases reported, which includes 42 new cases today from yesterday. In Tipton County, we're at 6,950 cases reported so far. In Fayette County, Tennessee, 4,665 cases have been reported. In DeSoto County, Mississippi, we've got 19,672 cases reported. And in Crittenden County, Arkansas, 5,404 cases reported so far. As far as the rest of the numbers locally, we've had 1,498 individuals who have died. And we had, in the month of February, 218 reports of death. We have 1,227 active cases, meaning 1,227 people have been diagnosed in the last 14 days. And other numbers of importance, in Shelby County, we have now tested 1,025,082 samples for COVID-19, and we've had a 9.8% positivity rate on those tests. And one of the things that we do want to emphasize to people is that the testing remains widely available in Shelby County. In fact, we have almost 17,000 community test site appointments available this week. So if anyone is experiencing symptoms, signs and symptoms of COVID, or anyone has been exposed to an individual who has been diagnosed with COVID-19 disease, we would definitely encourage you to please come out and be tested, because knowing your status is the first step in protecting others so you can isolate away and not share any virus you may have with other people and continue the spread. We have, in the state of Tennessee, 775,693 people have been diagnosed with COVID-19 so far. Switching over to vaccine numbers for a minute, we've documented 140,432 vaccine doses have been administered in Shelby County, and 97,881 of those doses are first doses. We also have 42,551 people who have been fully vaccinated through the vaccine campaign so far. So with that, I'm going to turn it over to Chief Doug McGowen for further comments about the vaccine campaign efforts.
Thank you, David. Chief Doug McGowen, representing the Joint Task Force today. I just wanted to talk a little bit about vaccines. So I covered a little bit of this last week, but I'll talk today just in general terms, and then I'll get into some specifics. The City of Memphis assumed responsibility for the distribution and inventory of the vaccines on Tuesday, the 23rd. At that time, we were transferred over just a little under 50,000 vaccines. We had about 19,000 that we received during that week that were added into the inventory, and that's what we began the work with. We began sourcing the sites the very next morning. In fact, we did 5 sites and about 6,500 doses the very next day. So there was no interruption into the vaccination program. Just a bit about the model that we were able to deliver today. In addition to what the hospitals and clinics are doing, for public pods or points of delivery, we will support up to 6 of those every day. We have 5 fixed sites that we will man every day, with the exception being Monday when the Whitehaven site is not open. So 5 public pods each and every day. The capacity of that is about 34,000 vaccines per week. In addition, we will source a 6th site each day based on demand and based on where we need to hold a pop-up pod so that we can flexibly meet the demands of the community. This week it has been at the commodity food site on Tuesdays and Thursdays where seniors get their food. That becomes the 6th site. We also have several other facilities that are that 6th site this week where we are delivering vaccine, and that will continue into the future. I do want to say that On Friday of last week, we sourced up to 11 separate sites on one day, including 2 Shelby County school sites and 2 sites for municipal schools, in addition to a site at a local church, in addition to the other 5 pods that we were doing. So that was a pretty robust day for us. Just a little bit about what we did last week. Together with the hospital systems last week, we delivered 41,225 vaccines to individuals. That's the number of people that were vaccinated in total from Monday to Sunday last week. And this week it will be a slightly smaller number because we're not doing the mass vaccinations for the schools. How we set our schedule is based on the inventory that we receive, and our county has been receiving about 13,700 doses. That's new first doses each and every week. That's been relatively consistent for the last 2 weeks and will be for next week as well. We get about the same number of second doses that come to us to support those second dose vaccinations. All told, after we took the inventory on board last week, after we delivered those some 33,000 vaccinations through our public pod sites this week, the city of Memphis began with about 45,000 total doses in our inventory. We have 34,000 appointments scheduled this week, and we anticipate that we'll probably get about 31,000 of those doses into arms. Unfortunately, we still have about 10% of people who are scheduling an appointment and are not showing up, so we're making some adjustments to accommodate that. Beginning next week, we should have our inventory down to about 32,000, and that means we're accepting about 6,000 new doses this week, about 11,700 second doses. So we'll have about 32,000 doses of vaccine on hand next week that we will administer. So on the week of March 8th, we'll have about 32,000 appointments available for people to take advantage of, and that will include, importantly, 3,600 appointments for people who need a second dose of Moderna. I know that has been a question for many people, but as of yesterday, we made a final determination that the 3,600 doses of Moderna that we have in our possession now are intended to be for second dose utilization. And so as soon as we made that determination, we opened up the vaccination appointment line for Mondays at the Pipkin building, so people can make themselves available of that second dose of Moderna. On Monday, we open up additional appointments for Tuesday and Wednesday if we need to, just to make sure that anybody can take advantage of that second dose of Moderna. So next week, 3,600 doses of Moderna, about 17,000 new doses of Pfizer, and about 11,700 new appointments for second dose Pfizer. The following week, March 15th, our allocation will go up from 13,700 for the county to about 20,200. Now that's the direction that we want to see it going. That means we'll be able to offer more appointments for individuals, both through our public pods, through our community clinics, and through our hospital systems. We're moving in the right direction. As you all know, we're aiming to get about 700,000 people vaccinated by this summer, by about the 1st of August, and we need to do 40 to 50,000 a week in order to achieve that goal. So we are on our trajectory and on our way to meeting our goal. The last thing I'll talk about is the transition of the scheduling system. We are continuing to use the Sign Up Genius system that was in place when we started working this program. That was a system that was put into place by the state of Tennessee. The state of Tennessee is moving to a new system called VRAS. It is in place in some of the rural counties already. We are working with the state to begin implementation of that system. We anticipate the week of 15 March is when we will be able to bring that system online. That's our estimate today. I'll keep you updated if anything changes with that. That new scheduling system is a little more flexible, gives you the ability to have a second dose scheduled, makes it more flexible for our staff to be able to have it automatically uploaded into the tracking system, which is called Tennis. And the other note I'll have is the 222 shot line. We're very thankful for our partners at Shelby County who continue to man that line. We have thousands of appointments that are still available through 222 shot, both for this week and for the Moderna doses next week. And so please, if you need an immunization, feel free to use that 222 shot line. That program will also be transitioning. We anticipate there will be a professional call center that's brought on board. We're evaluating several options right now so that we can have more people, more hours of the day to be more responsive to people who need to use 222 shot in order to schedule their appointment. So with that, I'll conclude, and I'll turn it over to Dr. Bruce Randolph, our health officer here for Shelby County, and then we'll be back for any questions you might have. Dr. Randolph.
Thank you, Mr. McGowen and Mr. Sweat. Greetings, fellow citizens of Shelby County. I'm Dr. Bruce Randolph, the health officer for Shelby County Health Department. And I just want to highlight a few things before we open up for questions. We're rapidly approaching the 1-year mark when we first found out that we had a case in Shelby County. And during this year, we've gone through some challenging and difficult times, but we're here. And we've gotten to a point where now we are seeing downward trends in a lot of our critical indicators. And we have the vaccine now on hand. And it is very important that we understand that we must continue the course. First, I want to just thank you, fellow citizens of Shelby County, for your cooperation and all that you have done to help us get to the point where we are at this time. I also want to just simply say that we certainly regret the unfortunate events that took place, but we're asking that you continue to support our efforts, continue to follow the safety measures outlined in the health directive, and we're moving forward. I want to make it very clear to everyone there's not a conflict between the Shelby County Health Department and the city of Memphis, as some had rumored. We are partners in this. We are working together. I'm the health officer of Shelby County, and from last that I remember, Memphis, the city of Memphis is a city in Shelby County. We are partners in this, and we're going to work together. We're going to do whatever it takes to make sure that every citizen who wants to get vaccinated in Shelby County will indeed be vaccinated. And so that's the bottom line. It's about getting the job done. And whoever can do the job best and is in the best interest of the people, that's what really matters. I want you to, fellow citizens, to really hold the course. We still got to wear the mask. We still need to maintain social distancing and avoid crowds and poorly ventilated areas. Even if you've gotten your shot, even if you've gotten your vaccination, we still need to adhere to these things. And get tested. It's very important that we still need to know our status. We still need to know, especially in light of the fact that we have several variant viruses around, we need to be able to identify who may be infected with these so we can place them in isolation and quarantine at an appropriate time and as soon as possible so we can continue to avoid the transmission and we continue to make progress. Also, get vaccinated, and when you schedule your appointment, if you can try your best to keep it, but if you can't, at least let them know so someone else can get that spot. Please, if you don't make multiple appointments at different sites, because when you do that, you are denying someone else the opportunity to be able to access the vaccine. I've gotten multiple calls and complaints about the fact that as soon as the availability of appointments are posted, they are taken away. And then when we're having a 10% no-show rate, then that really creates some problems for us. Last thing that I would want to just mention, and you may have heard that the Johnson & Johnson vaccine has received emergency use authorization. We don't know exactly when we will start receiving the vaccine. Mr. McGowen might know, he's been in communication with the state. But one of the things that I want to say about this vaccine, and there'll be more as we learn more, is that it is a different vaccine. It's not the same as the Pfizer and Moderna. It is easier to administer in the sense that you don't have to be so concerned with maintaining the temperature as you do with the others. And even though the efficacy is less than that of the others in terms of moderate infections, the key component and the main reason why you vaccinate anyone is that we're trying to avoid deaths. And this particular vaccine is 100% effective in preventing deaths, just as the Pfizer and the Moderna, and it is also 85% effective in preventing the severe and critical cases of COVID-19. And that's the ultimate goal, is to keep people from being sick and requiring hospitalization, and of course, avoiding them from dying. And the beauty of this particular vaccine is that you don't have to worry about a second appointment. It's one shot and that's it. And this would allow us to offer the vaccine to more people and get our people vaccinated at a quicker time. I'll stop there and entertain any questions that you may have.
Sam Hardiman, Commercial Appeal.
Doug, this is a clarifying question for you. You said 20,200 on the week of March 15th, the weekly allocation would go up to, and why is the allocation increasing? What's the reason for that?
Sure. Thanks, Sam, for that. It is just because of the increased production that you've heard about, where Pfizer is increasing its production. Moderna is also increasing its production. We will predominantly be receiving Pfizer for the public vaccinations here. But it's a direct result of the increased production, therefore the direct result of increased allocation to the state of Tennessee and then to us. Just a clarifying comment, Sam, that is for the entire county. I think I explained this last week, but so this coming Wednesday, we will be planning for that week of the 15th of March. We will get together with the hospital systems, the clinics, our public pods, and all of our partners to say, okay, we're receiving 20,200 first doses. How should we apportion those? So, for instance, Christ Community Health Services might request 1,000 doses. Baptist Memorial Hospital might request 5,000 doses. Methodist might request 2,000 doses. And then our public pods, we know we would like to maintain presence there, so we'd like to have, at least 5,000 to 6,000 doses that we can offer. And then we send that to the state, and they apportion it out to us, and they send it to all of the partners. So we will have more to distribute, which is good news. I'll take this moment to also offer what Dr. Randolph mentioned. We do not yet know exactly how the J&J vaccine will be allocated across the state of Tennessee. And we also do not know yet exactly the strategy. Will that be available for general public vaccinations, or will it go to specific demographics and audiences, for instance, the homebound or the homeless populations? The state is working on that, and they will make us aware as soon as they have decided on that course of action.
And then as a follow-up, I noticed last night that the amount of people that actually received a shot yesterday at various sites was below the scheduled appointments. You guys are saying it's about a 10% no-show rate. How does the city and the county adjust when people aren't showing up for their appointments? In particular, what happens to the vaccines that maybe were readied for those people?
So, yes, so there was about a 10% no-show rate. So I'll just be clear. Specifically for Pfizer vaccine, we try to estimate exactly the number that we need to be prepared the following day. So we will have a mix in stock at the Memphis Fire Department will have some number that are already thawed, and they're already on the 5-day ticker before they will be expired. And then we will decide how many we need to thaw for the next day from the freezer. That is balanced by what we have to bring back at night. So Dr. Randolph mentioned it. If you have an appointment, please show up. But we do our best to try to apportion out to the sites. If I have, and I'll just give a rough example, if I have 1,000 appointments, I will try to allocate just enough doses to cover that plus what the no-shows are. I'll be completely candid. That is a work-in process to be as precise and as tight as we can. You don't want to undershoot and have not enough vaccine to meet everybody that shows up at their appointment, and you don't want to overshoot and have too many there, and at the end of the day, you're just bringing too much back into your inventory, and you have too much thawed that is now on the clock that needs to get out. So it is an art, and we're working on trying to perfect that art, and we're also, at the end of the day, there are some doses that are drawn into a syringe. Once they are in the syringe, you only have 5 hours to administer those. And that's where we're calling people who are on the list, the VaxQ list, or any other people that we've identified ahead of time. If they have it in the syringe, we only have 5 hours to get it out, and those are the folks that we're calling in.
Omir Yusuf, Daily Memphian.
Hello, this question is for Doug. Now, once you all eventually do get the Johnson & Johnson vaccine, how will you go about letting the public kind of decide which of the three vaccines they could choose from?
Sure. I anticipate, based on our discussions with the state, that we will open it up for appointments just like we are doing others. So today, when you go online, you can select the site and the vaccine. Admittedly, we are not administering we in our public pods are not administering any new first dose Moderna. The state has decided that we will be receiving predominantly Pfizer. One of the reasons is that the large metros are receiving Pfizer. We have the medical institutions who have the deep freeze capacity in order to store that. Many of the rural counties do not, and as you know, Moderna and J&J need much less specific refrigeration and freezing requirements. So we'll advise, we'll set up appointments, and I believe it will be as simple as, here's the site, it operates from these days, and anyone who wants a Johnson & Johnson should sign up on this date for this site. More specifics to follow, but it shouldn't be any different from what we're doing today. Follow up, Omar? Okay.
We'll move on. Kelly Roberts, WMC.
Good afternoon. My first question is about, it looks like the city council working to allocate about $1 million for vaccine distribution with the city. It sounds like in the budget committee hearing this morning, there was talks about maybe using that money to set up another public vaccination site. Can you talk about, getting that money and exactly what it could help you do?
Sure. Well, certainly this is not something that was forecast in the city budget, and certainly there are expenses, whether it be overtime or contracted support. We have contracted support through University Clinical Health and Christ Community who help us administer at certain sites. And so we do need, just like we had money from the CARES Act for testing, money to cover those tests and the equipment, the PPE that goes along with it, similar needs here for vaccines. So the $1 million will go a long way to helping us meet the financial requirements of administering vaccines. But there are also other sources. The state of Tennessee has received an allocation to support testing. It's about $360 million. They've received support from CDC of about $63 million to support vaccination. And then through FEMA and through the state's Tennessee Emergency Management Agency, there's also a rapid reimbursement model. So we are capturing all of our costs, and we will submit those costs that are eligible for reimbursement to those agencies for reimbursement. Certainly the $1 million will make sure that we are not cash flow constrained, so that we have the actual cash on hand to meet the requirements and pay the invoices that are coming to us on a monthly basis.
Thank you. And my second question, if you could again remind me so The state said that the Shelby County Health Department should have had about 20,000 extra doses in inventory. How long do you think it'll take the city of Memphis to get down to that kind of inventory? And as allocations increase, what is your plan to still have kind of what we've seen over the last week, kind of this effectiveness and this efficientness, even with, almost eventually, double the amount of doses at least coming in?
Sure. So I guess what I mentioned early on is that this week we started with about 45,000 and we set about 34,000 appointments. So that was obviously down. The inventory is substantially down because we did get a lot of it out last week. Next week, when we start the week, I anticipate the total inventory I'll have on hand is just a little over 32,000, and I'm going to set 32,000 appointments next week. So as far as working through the inventory that we have, we anticipate by the beginning of next week, we'll have worked through that, and we'll begin administering those doses over the course of next week. And then each and every week, we'll continue to receive our allocation of first and second dose, and we should be in a really good position to accept an ever-increasing number of doses. So if you think about it and do the math, if out of those 13,000, I was receiving 6,000 first doses, and I was doing about 12,000 second doses, that's only about 18,000. Well, as you know, I'm doing 30,000 appointments. Fast forward to the week of the 15th, if I'm to receive an increased portion, let's say 10,000 first doses and about the same number of second doses, that's only 23 to 24,000. So I believe that we have capacity to continue to absorb through the model that we have in place. Our partners, we have engaged with them to find out what their capacity is to absorb more doses. Again, as it stands today, with the pop-up sites, with the public pods, that's about 34 to 40,000 doses a week that we can administer. Our hospital systems last week did 7,500 doses, so we're already at 47,000. And again, to be on pace to be done this summer, we need about 40 to 50,000 this summer. We are forecasting ahead. If the need is there, if the demand is there, we will work to source and open up additional capacity to serve the public.
Brad Broders, Local 24.
Thanks, Doug. Thanks for the time, as always. Kind of following up a little bit on Sam's question earlier, could you kind of, for the public out there wondering, the city's role now in overseeing VaxQ and making sure if there are last-minute available doses at the end of the day that they can be administered? Has any changes with the city on that?
So, yes, so far I believe that we had already had a list of 50,000 people on VaxQ. A couple of things have happened. We have stopped accepting new members into VaxQ just while we assess the efficacy of that system and our ability to use it. There's a bit of a learning curve for us. One thing we did is we downloaded the data, we sorted it by age. We also sorted it against people we know have already received the vaccine, and so we try to remove as many people off the list that had already received the vaccine. And then we sorted it by age so that we know people who are early in the phase are the first people that we call. So we have been using that. I will tell you that our team is looking at that to determine if that's the appropriate tool to use going forward. I'm not going to judge VaxQ one way or the other. I just say that's the system that we had. We do have a heck of a lot of names on there, and those are the folks that we will call at the end of the day. I think the criticism before was that just a number of people showed up. That may have been conflated with VaxQ, but we will call people in order of priority based on the age range that's there.
Thanks, Doug. And as my follow-up, a little while ago, Fire Director Gina Sweat announced the 700,000 administered goal August 1st. I know you and her are working together as a team. What's your thoughts about that goal, the likelihood you all can achieve it, and kind of what it's going to take to get there?
We can achieve it. It's not really a significantly changed goal. If you watch what the health department puts out, David, it's 650,000, I think, was our objective. So I round that to 700,000 by the 1st of August based on where we were, and say that's an objective we're going to get to. Again, 40 to 50,000 doses a week, and that, about half of that is first doses, and we can get there by the 1st of August. I am absolutely confident of that. That did not count new J&J coming in, which obviously does not need a second dose, so that's going to accelerate our progress as well. Sustaining the pace that we have now is what we're working on. We think we've been able to take this on, been able to deliver with our partners, and I'll thank Dr. Randolph for saying that again. This is a team effort. It's a partnership. We're just doing one part of this here, and we need all of us to be successful. So we're going to continue this pace, and we're going to accept more new doses, and we'll get it into arms of people who need it, and I'm confident that we can meet that goal.
Adrian Sands, AP.
Yes, hello. I was wondering, considering the issues experienced in the last month or so, is there any indication that anyone received an expired vaccine in Shelby County?
So as far as, I can let David or Dr. Randolph speak to that, but I do know that the Tennessee Department of Health is here and the CDC is here, and they're working to determine if there was anything like that going on. And I spoke with them yesterday at length about what our program is here, and mentioned, based on what I had heard, just like you did, there's some talk about a revaccination. That's not my worry today, but if that becomes a requirement, then we will handle that appropriately. We will let everybody know, and we'll make sure that if that becomes something that we need to do, that we schedule it and give people a heads up about who needs it and where it can be done. Yeah, go ahead, David.
So thank you for the question. As far as has been mentioned earlier in the broadcast, the issue with the Pfizer vaccine, because of its extreme specific temperature requirements, is that once you thaw it out, you have 5 days to use it. And the doses that expired in the pharmacy. They were thawed out in the pharmacy, but they never left the pharmacy to be used, so no one was put in jeopardy of receiving doses that had been thawed out for more than 5 days. So that issue did not prevail. We are grateful for the presence of the CDC to work with the Shelby County Health Department and the Tennessee Department of Health to understand and all the factors and put in place best practices to ensure nothing like that would ever happen again. But the specific answer to the question is no.
Thank you.
And with that, we are over time. I do want to thank everyone for continuing to follow this story, the story of the pandemic. It is the greatest public health event of our lifetimes. And the joint task force that this briefing is on behalf of was formed almost 1 year ago. And so we, over the past year, have taken a very arduous journey, but we've also formed very strong partnerships, and we will continue to be a joint task force, a partnered task force, until this pandemic releases its grip on our community. Thank you for all your assistance.
Thanks, everyone. We'll see you back here Thursday.